gentlemen, have you ever noticed that the longer you sit, the worse your testicle pain actually gets? Maybe it's during work, driving, gaming, or just sitting on the couch. If that sounds familiar, you're definitely not alone. As a men's pelvic floor physiotherapist, I see this pattern all the time. Men go to the doctor, receive imaging, only to be told that their tests come back normal. In this case, that testicular pain can actually be coming from your muscles or your nerves. Today, I'll explain why prolonged sitting can actually trigger your testicular pain, and I'll show you 3 simple exercises that you can start doing today. Let's first look what happens when you go to sit. When you sit in a chair for a long period of time, several things happen simultaneously. Your hip flexors contract. Your low back often rounds into flexion. Your pelvis can tilt backwards into a posterior tilt, and your abdominal wall becomes shortened. None of these things are necessarily bad by themselves, but the problem can arise when you stay in that one position for too long without moving. Here's something many people don't realize. The nerves that supply sensation around the groin and testicles actually begin much higher in your lower back. The genitofemoral nerve originates from the upper lumbar spine, primarily around L1 and L2. The ilioinguinal nerve comes from a very similar area. These nerves travel through the abdomen before reaching the groin and portions of the scrotum. If prolonged sitting causes increased stiffness or sensitivity around the lumbar spine, or increased tension in the surrounding muscles and fascia, these nerves may become more sensitive in some individuals. That doesn't necessarily mean that the nerve is trapped. It often means that the entire system has become more irritable. So sometimes what feels like pain in the testicles is actually referred pain coming from structures much higher up. Now let's move to the front of the pelvis. When your hips stay bent all day long, the tissues passing underneath the ilioinguinal ligament are continually compressed. This area contains muscles, blood vessels, connective tissue, and nerves traveling towards your groin. As your hip remains flexed, the hip flexor muscles can gradually become more stiff and overactive. The abdominal muscles also remain shortened. Together, all of these tissues can increase pressure around the front of the pelvis. For some people, this contributes to that irritation of the genitofemoral nerve or ilioinguinal nerve, both of which help supply sensation to the groin and testicular region. Again, it doesn't necessarily mean that something is damaged, it simply means the area has become more sensitive. Now let's talk about the pelvic floor. The pelvic floor sits directly underneath your pelvis. When you're sitting, your body weight rests directly on these muscles, and if you've been sitting for several hours, many people unconsciously tighten these muscles without realizing it. Sometimes this happens because of stress. Sometimes because of a guarding from a previous acute pain episode that never fully recovered, or sometimes simply just from sitting too long. These muscles work closely with your abdominals, diaphragm, hips, and low back, and if the pelvic floor becomes tense, it can also increase sensitivity around another important nerve called the pudendal nerve. The pudendal nerve supplies sensation to the penis, scrotum, and perineum. Again, we're talking about increased sensitivity, not permanent nerve damage. Just very quickly, I want to take a moment to address how challenging it is for men to live with something like testicular pain. Talking about men's health is highly stigmatized, embarrassing, and finding the right information can absolutely be a struggle. Starting today, I want to create something called the Men's Health Pact with my viewers. If you learned something from this video, leave a comment. If you want to share your story, or you could write something as simple as the words Men's Health Pact. That small action can help another man just like you find the information that can make a real difference. So, with that brief understanding of the anatomy, it's important to understand that these systems don't work independently. Your lumbar spine, your abdominal wall, your hip flexors, and your pelvic floor. All of these things influence each other. That's why simply treating the testicle itself often doesn't solve the problem. Sometimes the real issue is how your body is tolerating prolonged sitting. So, the first exercise is something I recommend to almost everyone who sits for work. Stand up every hour and place your hands on the backs of your pelvis or your hips. Gently lean backwards and then return to standing. Repeat this for about 15 times. These repeated lumbar extensions help reverse the prolonged flexion posture that develops while sitting. Think of it as resetting your spine throughout the day. The second exercise is a hip hike off of a step. Stand with your working leg on a small platform. A step around the house will do just fine. Grab an external support such as a dowel for balance. And you want to keep your head, your shoulders, and your chest and back as tall as possible, keeping your low back extended, your hip joint slightly forwards, and your knee fully straight. If you're in the correct position, you should feel like the glute muscles on the side of your stance leg are working to keep you upright. Then, use your stance hip to drive your pelvis towards the floating leg. Slightly move your floating leg to the side in the process. What you want to feel is a good burn on the side and the slightly back of your glute. Perform for as many repetitions as you can, thinking about squeezing your glute during the loading phase. If you're having a hard time feeling this in the right area, you might not have your hip far forward enough, low back upright, or your knee fully straight. This strengthening exercise can especially be helpful for men with testicular pain because we're performing an exercise where our low back is remaining in extension, and we need this alignment if our low back is constantly in flexion. Finally, third exercise, a standing groin stretch. Take a wide stance and shift your weight towards one side. You should feel a gentle stretch along the inside of the opposite thigh and groin. Hold for about 30 seconds and repeat both sides. Remember, stretching should feel comfortable, and we don't want to force things to the point of pain. So if your testicle pain is constantly worse after sitting, your body may simply be telling you that it needs more movement. Sometimes, small changes throughout the day can make a huge difference. Remember though, if you develop sudden severe testicular pain, swelling, redness, fever, nausea, or a new lump at the testicle, you should immediately seek urgent medical attention. These symptoms need prompt evaluation because they can represent conditions unrelated to muscles or posture. Seeing your doctor is always going to be the first best step. And if you like my content, every like, subscribe, and comment helps those videos reach men who are struggling with conditions just like this. Thanks for watching.